up, which way does her vagina point? Someone needs to answer this question for me. I can't be... If you look at the back, so... I'm not sure what that is. All right. Bladder, vagina. The back of the vagina is somewhat horizontal. So if a woman has sex, and she comes to see me 2 days later, and I do a pelvic exam, I can see sperm back there. So semen will pool at the back of the vagina. Why am I telling you this? Because when a woman has sex, her exposure is her exposure to semen. And within that environment, which is normal temperature, normal moisture, normal pH, that semen is still there. And so her exposure is actually much longer than the sexual act. It's for as long as that's there, which can be a couple of days after. It's why the rhythm method for preventing pregnancy doesn't work. So the normal vaginal environment as it exists is made to be somewhat protective. There's an immunology there, there's a physiology there that protects it against abnormal or unusual pathogens. There's a bacterial balance that's there, lactobacilli are there, and all of those things are protected. There are things that happen to disrupt that. Vaginal infections, sexually transmitted infection, an overgrowth of yeast, an overgrowth of bacteria that may or may not be sexually transmitted, microabrasions that we talk about that may happen during sex or may happen during an infection. And then semen itself actually has some parameters that may either make it protective, but also can make it something that enhances HIV infection.